I went to the hospital in an ambulance, but when I got there, I found out that my baby was dead.
Couldn't get to the pregnant woman because of the fighting. The baby died because the mother couldn't be taken to the hospital in time.
Conflict, transportation barriers, curfews, deteriorating health services and skyrocketing commodity prices. These have all become major problems for expectant mothers in Tanintharyi region. They're also problems with tragic consequences. Hello and welcome to Dawei, a weekly podcast that brings you human rights stories from Myanmar. It's brought to you by Fondation Hirondelle. This episode is produced by Dawei and Dawei Watch. Names may have been changed to protect contributors.
We have no savings, and I cried because I didn't know how to solve my problem. My husband borrowed 150,000 baht from others. I went to the hospital in an ambulance, but when I got there, I found out that my baby was dead.
Dawei Sint and her husband live in Outyepu village, Laonglong Township, with their 3 children. They try to make a living as odd job workers. They earned a regular income before the military coup in 2021, but since then her husband struggles to bring home even 6,000 baht per day. In early 2022, Dawei Sint became pregnant, but their difficult financial situation meant she still had to work. She went to the woods to cut down bamboo and firewood. She also went to the seashore 3 miles away to collect snails and worked at a fish drying facility.
I had to work even though I was pregnant. My husband's income wasn't enough for a family of 5. I didn't know how I was going to give birth to my child.
Before the coup, many villagers like Dawei Sint, living in rural areas, would have had access to at least a midwife and a healthcare worker. But after the coup, some medical staff joined the civil disobedience movement, and sometimes conflict breaks out, making it unsafe for health workers to travel to some villages. Dr. Min Han in Dawei Township described the situation for many rural women.
For expectant mothers, it is better to give birth with skilled midwives. In some places where healthcare is not accessible, pregnant mothers give birth to babies with the help of traditional birth attendants who don't have a high level of education. Myanmar's health and education systems have collapsed since the coup.
Dawei Sint was not able to get regular checkups. Neither did she have access to the free iron and zinc supplements that were previously available, and the family's low income meant her nutritional intake was poor. One day, about 8 months into her pregnancy, she was cooking bamboo shoots to sell at market. At one point, after she lifted a pot, she started to bleed from her uterus. A midwife who had joined the CDM advised her to go to hospital. The family took her to Dawei, but it was too late. She had to give birth to the lifeless baby by caesarean section. It would have been her 4th child. Local emergency ambulance services told Dawei there have been more miscarriages and stillbirths in Tanintharyi region since the coup. In some areas, ambulances can't get there in time due to fighting. Soyan Nai is a member of a local emergency ambulance group in the Kamongthwe area of Dawei Township. He remembers one incident like this from last year.
The expectant mother asked us to send an ambulance because she couldn't get help from a traditional birth attendant. At that time there was fighting going on near Wakong village and Mount Bay Metet. We couldn't get to the pregnant woman because of the fighting. The baby died because the mother couldn't be taken to the hospital in time.
In other cases, he says some women give birth in the ambulance and the babies don't always survive. Soyanai says his group has carried about 20 bleeding or miscarrying patients from the Kamangthwe area to hospitals since the coup. In heavy conflict areas, fighting and checkpoints make it virtually impossible for women to get to hospital, particularly during curfew hours, as Soyanai explains.
Pregnant women can go to the hospitals in the daytime, but they are not allowed to go to hospitals at night. If the patient is in an emergency, we phone KNU officials and ask for permission to go to the hospital in Dawei. We can send pregnant women to the hospital only with permission from the KNU liaison office.
Dawei Watch in Thayetchang Township is one of the areas where fighting erupted when the opposition National Unity Government declared war against the junta in September 2021. There is frequent fighting in this area and many checkpoints. The regime bans delivery of medicines and foodstuff to the Dawei Watch area. Gomin Ye is one of the leaders of Apu Yang Mita, a local charity in the area which provides healthcare services to IDPs. He says in IDP camps, women can only give birth with the help of unqualified people and basic medical equipment. And he says IDPs, including pregnant women, are not getting the medicines they need in the area.
We have to buy as much medicine as we can when we have it. We face shortages of medicine and food as we have been displaced by the fighting since a month ago. The IDPs are malnourished. We also face difficulties in transporting medicine into the area. The junta has banned delivery of medicine. There are also very few donors who donate medicine for the IDPs.
In rural and conflict areas around the country, many pregnant women are not getting the healthcare they need, and lives are being lost as a result. Like Dawei Watch's baby. If her child had survived, it would have been 8 months old now. She looks at babies of the same age and mourns her loss.
I went to the hospital, but I had to come back without my baby. Other families had their newborns, but my baby passed away. I was devastated that my child died. I remember my baby when I see others carrying their babies.
We hope you enjoyed this edition of Dawei. You can listen to our podcast via the Dawei Facebook page. It can also be found on SoundCloud, YouTube and iTunes. You can also listen every Saturday night from 9 to 10 p.m. and Sunday morning from 6 to 7 a.m. on Voice of America Radio. The project to support human rights reporting is delivered by Fundación Hirondelle, and it's made with the support of our donors.